Hello, I'm Melissa Atkunda, a medical doctor by profession working at Rocket Health, and today I'm going to be talking about diabetes mellitus. This is a chronic disease characterized by high levels of glucose in your blood. And this is because the pancreas is not able to produce enough insulin, or because your body is resistant to the insulin being produced. Insulin is a hormone that ensures the glucose in the blood enters the cells, and without it, the glucose is going to remain in your bloodstream. Some of the signs and symptoms of diabetes mellitus include excessive thirst, excessive hunger, frequent urination, especially in the night, blurry vision, numbness of the hands and feet, meaning you're not able to feel your hands and feet, as well as a tingling sensation, and this one is characterized as pricks and needles in your hands and feet, as well as excessive weight loss when you're not even trying to lose weight. There are three types of diabetes mellitus. Type 1 diabetes mellitus is when your body produces little or no insulin at all because the cells responsible for producing the insulin do not produce it adequately. One of the reasons is an autoimmune reaction where your body attacks itself by mistake, injuring the cells that are meant to produce the insulin. This one is more it can develop at any time, but it's more frequent in children and adolescents. Type 2 diabetes mellitus is when your cells resist the insulin being produced, despite your pancreas being able to produce sufficient insulin. This is the most common type of diabetes, accounting for 90% of all cases, and it's more common in adults. And the third is gestational diabetes, which is induced by pregnancy, resulting into complications for both the fetus and the mother. Some of the risk factors of diabetes mellitus include obesity, meaning you're overweight, as well as unhealthy eating habits, meaning most of the food that you're eating are either fats or carbohydrates. And to prevent this, your diet should include more of fibers and less fats, as well as less carbohydrates and plenty of water, as well as a sedentary lifestyle, meaning you're physically inactive, as well as excessive alcohol intake, because this can as well damage your pancreas, hence damaging the cells that produce the insulin. As well as family history, because if you have a father or a mother or a grandmother or a sibling that has diabetes mellitus, there are high chances that you as well may develop diabetes mellitus. Having heard the risk factors of the development of diabetes mellitus, some of the ways to prevent the development of diabetes mellitus include being physically active. This way you'll be able to maintain a healthy weight, as well as having a healthy eating habit, meaning you should reduce the amount of fat that you eat, reduce the amount of carbohydrates you eat, and instead increase the amount of fibers you eat. Some of the foods that have high fiber in them are green leafy vegetables like the cabbage, lentils, as well as some fruits like pawpaws, mangoes, and some legumes like small sweet potatoes, as well as brown bread, that is whole wheat bread. Also reduce the amount of alcohol you consume, because high amounts of alcohol affect the pancreas, which is the organ that produces the insulin. Once again, I'm Melissa Atkunda, medical doctor at Rocket Health, and I wish you all a healthy lifestyle.